At the National University Cancer Institute, Singapore, we provide excellence in cancer care for our patients. And that's our commitment for life. For 3 decades, we have been anchored by healthcare professionals who push boundaries to pursue excellence.
Medical oncology was a very new specialty and many people are not familiar with it. If you have advanced, say, lung cancer or breast cancer, there were only less than 4 to 5 drugs that were available. I don't really push the specialty, but I push the treatment that I can offer patients. Medical oncology is not just giving anti-cancer drug, it's a total care of patients with cancer.
A new generation of doctors began pioneering cancer treatment strategies. Clinical trials of promising drug therapies developed for Asian patients brought the team a step closer to their commitment of putting patients first.
I thought it was very important that Singapore develop its own expertise for cancers common in Singapore. And I wanted Singapore to be one of the major hubs so that when a promising drug is being developed, it's not just developed in North America and Western Europe, but it's also developed in Singapore. And NCIS is one of the major sites of offering this to all our patients.
With this move, we can consolidate all our services. The pharmacies, the therapists, the social worker are all together as a team to look at the patient and to serve patient.
Our commitment to deliver world-class cancer treatment was complemented by developing best practices in patient care.
Oncology nurses are different from other people. It takes that calling, that passion in each nurse to provide that care for patients. Most of our nurses are young. They have not even seen a death before. So when the patient said, yeah, the doctor gave me 6 months, what does that mean? If you're an oncology nurse, it comes naturally. That's why we do a lot of research and a lot of projects to ensure that we give good care for our patients.
Building on the legacy of the pioneers, NCIS continued to blaze a trail as we embarked on research into uncharted areas of cancer treatment.
Being an academic cancer center, we have opportunity to carry out research looking at novel therapies or novel combinations or novel immunotherapy. The idea of harvesting the patient's own immune cells and manipulating them in the lab to make them more effective against the cancer cells, that technology is improving every day.
We continue to push boundaries of existing treatment strategies by adopting cutting-edge technologies.
The keyhole surgery, especially with the help of the robots, that we can allow us to perform complex surgery in a less invasive way, and that's translated into a quicker recovery and a better quality of life for the patient.
For NCIS, the future of cancer care continues to be anchored on patients and their families. With the patient as a partner and technology as an enabler, we are committed for life to co-create excellence in cancer care.
In the next phase, we actually view our relationship with the patient more as a partnership. We want to look after them from the diagnosis to really, the rest of their life, in essence. Hearing their input and knowing what they really want in terms of their treatment will be very important. I think technology will definitely become more and more important in the next phase of cancer care. We have a few projects to use data to predict patients who are likely to have a cancer diagnosis within the next 1 year. We're also building algorithms that will actually identify patients that will benefit from clinical trials or specific treatment. So this is really a commitment that we have to our patient, for life.
At the National University Cancer Institute, Singapore, we deliver excellence in cancer care with a commitment for life to our patients.